So I want to give a little bit introducing why we have Taiwan AI Lab here. Actually, in Taiwan, we have a very good history. Like we have a opening of the development. For example, in the very early age in 1994, we have a opening foundation in Taiwan. We actually developed the very first Chinese search engine in Taiwan. So if you see the right hand side, who was the guy at the right hand side? It was Larry Page. So Larry Page actually partnership with the very first Chinese search engine. That search engine is actually funded in Taiwan from a nonprofit foundation. And we have three main directions in Taiwan. The very first one is the medical care. Because Taiwan have the top ranking of the healthcare system. So we have a best doctors here. We have a lot of very accurate data here. So we can do a high quality healthcare research. And the second part of it is just we already mentioned one of smart city we studied tomorrow. Smart transportation in a smart city is one of our target areas as well. And the very third topic is human computer interaction, including the speaker recognition, language understanding. So if we want to collaborate with the best talent who know Mandarin, but not in China, Taiwan is the best place you can collaborate with. One of a very good example is we now have a collaboration effort with the global governments that we have a platform to fight COVID-19 with Taiwan AI solution. You can actually go to this website, covirus.cc, covirus.cc, to see the effort. Right now we are investing to fight the COVID-19. All these solutions under Taiwan AI Lab, we are open agreement, we are open source. We welcome all the government's collaboration continue. So that including like a health report app. So how the user can use the face recognition, language understanding to report their health condition. And we also have our social distancing app, how we can using a decentralized approach to know the virus transmission without hurting people's privacy. I mean, we also have a AI classifier. You can read the chest rate and identify if you have COVID-19 or not. It is correct with the best hospital in Taiwan, and we have the agreement published available for the global hospitals. We also have leveraging the NGS, the next generation sequencing technique to track the virus transmission. And we also have a platform to support the drug selection if you want to do the treatment of the COVID-19. For all the medical paper, we also have a variant to literature platform to help to know the most recent research result about COVID-19 around the world. Continue. So this is how we are using Taiwan for this COVID-19 prevention and the tracking system. Continue. So this is an example of our health report app. It leverages facial recognition, speech recognition, and also language understanding. So people can just talk to the system, and you can report his health condition. Continue. And the social distance app I mentioned, we are leveraging the distributed approach. It is like a blockchain, but it's not. It's lighter than blockchain. It helps to store the transmission history without hurting people's privacy. Continue. And this is another solution we already establishing in Taiwan national insurance system. So we simulate the chest rate run in NHI, National Health Insurance System. Between the January to March, we seen 109 cases. We can actually catch the COVID-19 cases. 27 of them we can catch the COVID-19 cases before PCR tested. So if India is interested in this kind of solution, we can also collaborate.
So part of why Taiwan's response was also well prepared is because, from SARS in 2003, the spread of the disease was a huge impact to Taiwan's environment. And due to that experience, there was a lot of innovation that came out already. So what they started doing from 2003 was they started fever screening at the airport. They would use these high body infrared body temperatures that you're seeing everywhere today because of COVID. But even before COVID, Taiwan was already doing that for all passengers coming through. And that's really important because, they can catch cases early on from and prevent disease outbreaks from happening. And then the National Health Insurance Card. So this was developed in 2009 and was implemented in Taiwan. So essentially in this chip, it's linked to the e-health system, which uses a VPN network, which really protects the privacy of patients. And inside this chip, all you do is you go into a hospital, you give it to the doctor, they have access to your medical history. When you're doing your payments, your insurance, your personal history, it's all within a chip. And it's really flexible, and that's really why a lot of the innovation, could continue, and why Taiwan was prepared early on, because we had these things in place. We were very prepared early on, based on the experience from SARS 2003. Continue. So as Ethan was discussing in the last presentation, so this is what happens when someone comes to Taiwan. So if they were, a lot of our cases were imported, and it's really important that you stop imported cases early on because that's how you prevent community transmission. So when they first came in, they would have to do this online reporting for entry system. And then, it's an app that he was showing earlier, and you kind of register for it, you give them your details, and it's really simple. You go home, you stay quarantined. But what's interesting is how the mobile technology, they kind of developed this electronic fence system where they can check where you are. And by seeing that location, if you leave that specific area, a notification will be sent to the civil administration, and either the health community officer or a police officer will come and check in on you if you left that area. So that's really important because, if someone breaks quarantine, we know the effects of how quickly COVID-19 is spreading. So by tracking with technology, it helps enforce home isolation and home quarantine. Continue. In the hospital, what we've done with the NHI card by saying that it's, such an important thing to have your country infrastructure ready for an e-health system, because, the simplicity of having a digitalized system that, everyone in the health sector can really access easily. What they did was they worked with the National Immigration Agency to link the data. And what happens is when you first come into the hospital, we take your health card, we screen it, and it'll come up letting us know whether you specifically had traveled to a specific area. If you have traveled under 14 days, then we know that, you're not supposed to be out of your quarantine, so we would put you outside and make sure we take the necessary precautions so we prevent hospital-acquired infections. And we can also check if you are a high-risk occupation. So people who are flight attendants, they have to still travel a lot. So it's really important that we catch these early on to prevent hospital-acquired infections. And with the technology, we also saw a huge innovation with the mask control system. So the mask rationing happened early on. So each citizen of Taiwan, they were given with 3 masks per week, and you had to connect it with your NHI card. So you go to these pharmacies, you give them your health card, and then that would be able to check on your purchase to make sure that we're rationing per citizen. But then people would get to these pharmacies and they wouldn't know how to access them because, some pharmacies would run out because they're highly dense populated. So, what Taiwan did is over 100 different programs have come out now. But what they did was they focused on open data. And by allowing that, there's a lot of innovation with technology where you can check. This picture here is showing that the green spots, that means that there's still masks available, and the red spots is where the masks are sold out. So you know not to go to that area to buy your mask, and you can get the supply in a ready time.